Good afternoon and welcome to Exploring Opportunities for IT to Help the Enterprise Reduce Costs, Increase Value, and Improve Margins. A health systems CIO production sponsored by GS Lab and GAVS Technologies. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor-in-chief of Health Systems CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time, and we will take them we'll in the Q&A box. We'll take them later in the program. Just so you see how we're going to spend our time today, first we're going to go about 35 to 40 minutes with our main panel discussion featuring Tanya Townsend, Chief Information and Digital Officer with Stanford Children's Health, Dr. Shafiq Rob, EVP, Chief Digital Officer and Systems CIO with Tufts Medicine, and Sumit Ganguly, CEO with GS Labs and GAVS. And then we will have our audience Q&A. So let's jump right in. Tanya, let's start with you. Can you give us an overview of your organization and your role?
Sure. So I am with Stanford Medicine Children's Health. You may also hear it referred to as Lucille Packard Children's Hospital, but we are part of Stanford, the Stanford community, so the School of Medicine. So therefore, we are an academic medical center. We are in the Palo Alto, California area. We focus on peds on the children's side, but we have 150 medical specialties, very large ambulatory footprint, many hospital partnerships. We have some great honors as far as the highest honor for nursing excellence. We're one of the top 10 children's hospitals, according to US News and World Report. We're recognized as a leader in this area. We have somewhere around 50 states that we see patients from, so we are a bit of a destination location. We have around 6,500 employees and 850 medical staff. So I'm the Chief Information Digital Officer and am just approaching my 1-year anniversary. So relatively new to the organization, but have been in healthcare IT my entire career, going on somewhere around 25 years or so.
Excellent. Thank you, Tanya. Very good. Shafiq?
My name is Shafiq Rob. I'm the EVP and the Chief Digital Officer and System CIO for Tufts Medicine. Lucky to be working here. Tufts Medicine is an academic medical institution with 3 other community hospitals. We have a home health. We also have a medically integrated network, where we do value-based care, and we do most transplant in the Commonwealth of Massachusetts. We're also known for the most cost-effective healthcare, and we are 2,000 strong employed physicians and about 2,000 community physicians that work here with us, who guide us. And we have an extraordinary 18,000 healthcare workers who I cherish and work with every day: nurses, doctors, MHAs, front-end people. We are also known for innovative way of working with value-based care, and we have also a medical school with Tufts, and we have a joint chief academic officer. So all in all, we're trying to do our best we can to serve the community that we are in. And thank you for inviting me. And Tanya is my friend, so and so is Sumit. So it'll be nice, Tony. You and I have known each other for a long time too. So
Yes, we're going to have a lot of fun. Yes, excellent. Sumit?
All right. They say a dwarf on a shoulder of a giant sees further. So it's an utter privilege to be in this panel with Ms. Tanya Townsend and Dr. Shafiq Rab. And we've had the privilege of having and serving them as clients. The company name, again, we've merged 2 companies and we're in the process of a new name. But right now it's GS Lab, Great Software Lab, and GAVS Technologies. And we are largely focused in the healthcare area. And we work for almost 40 healthcare providers. We've been doing some very interesting transformation work for payers. We work with some life sciences and med tech. but majority of our work has been largely with large healthcare providers. And this is most relevant because we are trying to remedy and address some of the cost issues which percolates down to IT.
Yeah, and that's really one of the things we're going to focus on. So very good. Tanya, we're going to start with you. We're kind of setting the stage here. It is widely reported that health systems are under significant financial pressure and margins are tighter than ever. How would you describe the situation and the financial pressures that health systems are under? I'm going to combine this with the other question, which is the overall pressure that health systems are under, and then the effect that that has on IT, and sort of how that changes either your budget or your marching orders, or your directives from the CEO and the board about what they want you to be focusing on.
Yeah, that's a really big question. All of those questions combined, that we will spend probably an hour on it. But there's a reality there. It's definitely accurate. I think revenue models haven't necessarily kept up with inflation. And so the pressure is just getting greater and greater in terms of how do we in IT help to eliminate expense, or find expense reduction opportunities. How do we create efficiencies in terms of adding volumes, creating efficiencies for our clinicians, and then of course, how do we ensure that we are getting all the revenue we can? So yes, yes to all of the above. I also think that, and I'm interested to hear what Shafiq's going to say too, but I also think that the traditional model for how IT is benchmarked in terms of the typical historical model is how much is your percentage of revenue for IT compared to the organization revenue, or your expense compared to the revenue. And I think those models need to shift because there is so much demand for IT. So of course, the tools that we're talking about, there is a cost increase. We're purchasing these systems. So that model definitely needs to shift, I think, in terms of the value that those systems are bringing. So we might be adding cost in terms of creating new expenses, but ensuring that we're really realizing the ROI and creating that value. But again, I just think the model is completely shifting on how we evaluate IT expense and IT value.
Very interesting point, Tanya. Before we jumped on the line, I was talking with Shafiq for a minute, and he mentioned the benchmark idea. So, Shafiq, you were talking about benchmarks. I think what Tanya is saying is that some of the traditional benchmarks that have been used to justify or to make sure you're in line with what everyone else is spending are no longer valid, right, Tanya? So this doesn't work. If you're trying to tie yourself to a particular benchmark, you may be setting yourself up for failure. Your thoughts, Shafiq?
So, brother, it's all about balance. So when you're asking that question, and healthcare systems have a mission, and mission is important, and the balance is important. We have a new, unique opportunity to reinvent ourselves, think differently, and innovate. The problem that lies is that, of course, we are judged by the old ways of doing things, as Tanya has mentioned. But at the same time, there is a new expectation from us. Generative AI has not left us. They are there. People are asking us to innovate, to create things. That pressure is there, and also to make us more efficient. So people are looking towards us for that leadership. But at the same time, we have to decrease cost. So that two dilemma is very important to recognize. And when you're asking to create new benchmarks, we'll have to reinvent ourselves. And fortunately or unfortunately, as you say, every crisis creates a new opportunity. So we're living in an era where we have a unique opportunity to do things that will actually catapult healthcare into a new way of delivery. Access is important, delivery is important, and continuous care monitoring is important. 24/7 lookout is important, and everybody wants us to give you risk alternate experience also. So that's also important. So think about the pressure and think how we are evaluated. So if you're asking to create a new benchmark, Vizient still does the benchmark for us, and that is done on based on productivity, and that is a number that the number of FTEs you can have and number of dollars you have to have. Fortunately, we are in IT. We can reinvent ourselves. So that is the answer to your question.
All right, Sumit, let's bring you in here. Dr. Rob has been talking repeatedly about, an opportunity in a crisis. So if the economy is, let's say it's not great, there's a lot of cost pressures, especially on health systems, and IT's in this interesting situation of being asked to help reduce costs by spending in a way, right? It's kind of spend to reduce, which is so what I want your thoughts on this dynamic of the pressures that IT is under and this concept that there is a huge opportunity here um, to help the organization by spending to reduce costs.
Sure. Uh, what I've realized that things that people remember are stories. So if you'll allow me the latitude of giving a very quick story, and when in 2009, 2010, Dr. Raab and Tanya, you may know this, Medicare and Medicaid in New Jersey, New York got defunded by around 10%. So there's this hospital in uh, South Bronx, Anthony, which was almost $1 billion, 800 odd beds. Medicare and Medicaid funded almost 70% of their total spend, and that got defunded by almost 10%. And then Stephen Anderman, the president, needed to do the same old thing for almost 70 to 80 million less. A very similar situation as this right now. This hospital served the poorest, I repeat, the poorest congressional district in whole of America. So in such a situation, it's not as if one can just move from Stanford Medical to go to a Palo Alto Medical. Actual healthcare would be hollowed out in South Bronx if they had to do something or they did not do something about it. That's when we came in, and we were lucky to have met them. It was a sheer case of being an accidental tourist. But we were able to reduce their IT spend by almost 35% in the infrastructure managed services area. We created a center because, again, latency is very important in Weehawken. We started supporting a lot of their applications and infrastructure. But the saving that they managed to get went back to clinical management again.
Mm-hmm.
It gives me tremendous pleasure and joy that in some way or form, through technology support, we were able to actually touch a human story that a vast swath of underprivileged group of people was supported by their healthcare system because of the cost out. I'm seeing that situation happen extensively. I was at and I'm sure many of you have been there at the JP Morgan Healthcare Conference. And all the 70 to 80 CEOs and board members who presented there, everyone from a 20 billion to a 40 billion to a 5 billion hospital system talked about a 2 billion, 4 billion, 600 million loss. This is unsustainable, this is untenable, and something has to be done about it. The total spend in labor costs, which constitutes almost 60% of healthcare IT, has gone up by around 4.25 billion, 60%. The actual cost of inpatient support is reduced. We are supporting a whole host of behavioral health system. 43% of the total cost is not being reimbursed for some of the inpatient behavioral system. So something has to be given.
Mm-hmm.
And this crisis needs to be solved through technology, through empathy, and through some transformational work.
All right, very good. So you mentioned infrastructure managed services as some of the ways you got that 35% reduction. Um, Tanya, sometimes, and at least part of reducing costs is it doesn't need to be, figuring out some amazing way to use Gen AI right? Sometimes it's just looking at your spend and re-examining all the dollars that are going out the door. And there can be tremendous savings in there. We'll get into application rationalization a little bit, which is a pretty complex and difficult thing to do. But some of it, as Dr. Rob mentioned to me before, is reducing licenses. When you have too many licenses, or there's applications that are not even being used. So things like that, just excess spending. When you have a huge budget, you're a huge institution and you have a large budget, there can be waste in there that can be probably fairly easily found if it's examined. So your thoughts there about sort of, we'll call it the low-hanging fruit, or sort of the stakes to play, the basic budget current spending review stuff.
Yeah, I think I would jump right into application rationalization as one of the key first opportunities. And so I think many of us have seen the mergers and acquisitions types of approach where you inherit, one of everything. The last organization I was in, it was built through mergers and acquisitions. And I used to say, you name it, we have it in terms of the application footprint. And so that is a huge opportunity. And I think we got there in a lot of different ways, but best of breed used to be the common practice until we did start to see more integrated platforms. So I would jump right into that as being a key opportunity, but that's easier said than done. You don't just kind of replace those things overnight. There's a change management component. There could be contracting, licensing components that you might be stuck with. We're in the process right now of moving to a new ERP, but again, you don't just turn that on and turn the other one off. You're required to have, that legacy data available for X amount of time. So very complicated, but those are typically good places to start. And then it's a lot of education with the organization around what we're talking about. And understanding, like, if we are going to be purchasing all of these different systems, and it does just add to your expense, and just education around that, because again, back to that traditional benchmarking model, you can't expect me to necessarily hit a target when we're adding new systems into our contracts, because the only other lever to pull then is your workforce, your labor. Which isn't, that's not going to get the job done either if you're tapping on the people to either do more with less, and or reduce your labor, which is also a tricky conversation. So I find this role a lot of education, and a lot of negotiation around how do we prioritize. So if we are going to have a finite constraint of budget and or people, how do we ensure we're working on the right things? And again, back to that value realization of proving that we're working on the right things. And sometimes we might not be. We might have to do that fail fast approach. And again, just a lot of negotiation and partnerships with the organization.
Very good. Dr. Rob, let's talk about application rationalization. So one of my questions here is, if each operational department has their own budget, right? And so if they want an application, it comes out of that budget. It doesn't come out of the IT budget. But you tell me if I'm wrong. I'm trying to understand where the incentives are. So if IT is tasked with application rationalization on an organizational level, and you go to a department and you say, well, why do you have this? And they say, listen, that's coming out of my budget. Leave me alone. What do you care? Right? So where does the monies come out from, and how does that affect an IT-led application rationalization program?
Tony, so I'm going to tell you 2-3 sentences, then I'll answer your question. So because you are trying to put me in a spot, and let me get out of the spot. So the first thing is that the people we work with, they're not in silo. That means the operations, the finance, the legal, the doctors, the nurses, we're all one entity. We are one people. Second is that to do anything, we have to build consensus. Third, we have to have buy-in. Fourth is that we are all in it together. The traditional approach for reduction in cost in IT, one lever Tanya mentioned is workforce. So you go to a benchmark and get to that number, and people will leave you alone. I get that. Second, I went after my password reset. 50% of the call is password reset. So you automate that, and boom, your tickets go down. Then another technical way of doing it, hey, we bought 3,000 licenses, we use 2,000 of them. Can you give me money back? Sometimes they will, sometimes they will not. In the next contract, you will decrease it. Then we go after how many we got. We got 3 of them. So to do that, when you're asking the app restaurant, so we had 800 applications when I first came here. Now we have about 200. So we got rid of 600 of them. So it didn't happen overnight. It's like trying to go to the cloud. So the basic ingredient of reduction in cost lies in the hands of our beloved. That means the people we love, the people we care for. That is our care transformation team, the nurses, the doctors, the patients who come here. Because our idea is to create impact, and we cannot do anything without them. We are here to serve them, right? So the answer to that is that we have to hear the way they work, and then we have to inform them, hey, this is what the change will. Tanya brought a phenomenal statement. She said, she's my colleague and my friend, and she said, change transformation that you're talking about is not the easy job. That is the hardest job. As leaders, we have to learn how to articulate, but at the same time, take the crutches of our chief operating officers, our CEOs, our chief nursing officers, because they are the pillars. They share their trust. Like sometimes people call it political capital, sometimes they call it something else. So one of the artful thing in decreasing cost is not cost, is actually what pain you are taking out of the people that you serve, and you replace that with something more innovative, less cost effective. And the part that does it is the coordination, because healthcare is broken at different places. Everything is not together, but if you provide things together, all of a sudden there is value in it. You know what I'm saying? And the last part of that, which you may or may not ask, is that we also like to innovate, whether we do a joint venture, whether we bring something from inside or we build something outside. So IT is being asked to do that too, create new sources of economy. And that is only possible. But what are we selling? We're selling workflow and processes that we have improved. And who are the architect of that? Our doctors, our nurses, our healthcare workers. So in fact, they are the one who's helping us make IT less expensive. Do you see the way I did not get into your spot?
Very good. Very good. Excellent. Sumit, I want to bring you in here. With your experience working with different companies, talk about application rationalization. Dr. Rob very eloquently said, almost you have to sell it, right? You have to bring them the data, the information. Perhaps, you have 3 of these and this one you almost don't use at all. So you have to sell it and convince them to be willing to part with that, as opposed to shutting it off in some aggressive, proactive way. But your thoughts around best practices and application rationalization, it sounds like that's a big, Tanya mentioned it, she said this is a big area where you want to focus.
Um, Again, I'll refer to 2 leaders. I've had the occasion to work extensively with GE. And what Jack Welch did, Tanya, Dr. Shafiq Rab, was almost an inflection point where he said, at this particular point, we will do some cost rationalization. And then it percolated down extensively. And then he put some measures, Anthony, where every leader who was associated with that particular way, directly or indirectly, as Dr. Rab said, they were incentivized and they were measured. So what did happen was you had a larger diktat, there was a business imperative, there was an organization imperative for cost out. It was identified that application rationalization would be a key Six Sigma initiative. And then it was percolated down to everyone. It was measured and associated with their key result areas.
Mm-hmm.
That's how leadership has a very key role in bringing this collaboration together. When Dr. Rab was talking about these disparate constituents that you have to work with, unless they see value, Anthony, they will not be aligned to it. So there should be a personal value, and they should also see the larger picture. And that's one thing that I've seen at GE, some of the best practices that could be brought into healthcare. That's one. And on the other side, actually, Dr. Rubb has been advising us that, again, there is some way or form to bring in economies of scale. There are GPOs like Premier Inc. Dr. Rubb talked about Vizient. There is a whole host of ways to find the money. And again, if in line with how we started this discussion, if we agree that we're going through an existential crisis and the core objective of healthcare providers is to provide efficient and highly cared service at slightly optimal cost, and if application rationalization is a corollary to that, it's important that when we address that. And we address it through leadership, alignment, and a heavy-handed attitude as well.
Interesting. So you're saying that if I'm understanding, you're saying it's also important for the operational leaders to have some skin in the game here and perhaps have some incentivization to get their department's application spending down. Like everyone has some incentives here, organizationally and individually, even on the operational side.
So Tony, sorry to interrupt you, man. The way you are asking the question, the thing is that it's not about money alone. What the way to think in a different way is that how do we become better? How do we bring joy in the practice of medicine? How do we make the care workers better? How do we support I like to call them our beloved, the people who we serve? How do we make the customer better, right? So, because everybody will get together if you put the patient in the middle. It's not that they will not.
That's right.
And the side benefit, as you call it, side effect, is that you decrease the cost too.
That's right.
That's the crux of the matter. I'm sorry to interrupt, man. Go ahead.
Yeah, one more comment on that too. So application rationalization allows us to potentially reduce expense, right? If we can truly retire systems that are no longer necessary. But I think another opportunity is leveraging the investments we've already made. So I would call that cost avoidance, so that when someone does come forward and says, I want this, best of breed solution, but we know we can do it with one of our current platforms that we've already invested in. That's another opportunity to just not perpetuate, adding the expense. How do we do the cost avoidance and appreciate the value of the partnerships that we already have, the systems we already have? And again, it's a lot of education on, the why don't we, why not, why aren't we gonna go down the separate path?
Tanya, can you go into that a little bit? Because it's a good intention, but we've heard that depending on the organizational structure, things can be purchased without going through IT, without sort of Tanya's signature on it, and you never get the opportunity to say, hey, you've got this, or we have this over here, or I have 15 licenses that aren't being used. So any thoughts there on how we make sure that you get that opportunity before the item's purchased?
Yeah, great question. I would love to know if anyone has completely solved that problem. But from a governance standpoint, we do have what I just talked about as part of our guiding principles. We're going to leverage our core platforms. I'm trying not to name too many vendor names, but we're going to leverage our core platforms. That's one of our guiding principles. We have a very robust governance structure that has multiple tiers in it. So if a new system is being evaluated or looked at, it should hopefully fall somewhere within that structure. And then lastly, we do have a stopgap in our contract management system that does ask if there is an IT component, please make sure that IT signs off on it. Again, none of that is full bulletproof. Like there still is some things that make its way into the system, and then we find out about it by the way. We kind of mentioned that earlier, but even grants sometimes make their way through that because they think, it's funded, but it doesn't necessarily include the resources and, the interfaces and the integration and all of that sort of thing. So it's a lot of education, and I'm very happy to say we have a very robust governance structure that helps hopefully prevent some of those by the ways.
Sumit, any thoughts there on what you see work from that sort of even that purchasing? If application rationalization is important and we can work on what we have, but we also don't want things popping up in the organization that nobody really approved of. It's a big problem. Shadow IT, gray IT, whatever you want to call it. Sumit, any thoughts there on anything you've seen work?
Yeah, and I'll kind of try and use a statement for what Dr. Rub was saying. If you can evangelize the why, the how shall follow. I think that's what I'm hearing from Tanya and Dr. Rub as well, that across the board, if we can explain the why we are trying to reduce cost and why application rationalization is an important element of the cost reduction to be more agile, more nimble, to really serve the beloved, I think a whole host of folks will follow through. I think very often we just directly get into the how part of it. And then people think we are kind of tugging at their coattails. And that's when the issue comes in. And the other aspect of application rationalization per se is that the whole idea of being agile and nimble is, again, Tanya, you were talking about it, that you have acquired some antiquated product, and just because you're using it and you're accustomed to use it, there has to be some way of form, a leadership from the CIO and the CDIO's office to try and give an alternative which is faster, cheaper, and better. And that's when people will adhere to it.
All right. Yes, very good. Very good. Okay, we're going to go we talked a lot about cost cutting, but let's talk about bringing value. This is something I've been, it's sort of a dynamic that I think is so important when it comes to IT executives, and that's that lead versus follow thing. Follow may be an old school mentality, which is if it's asked for and it has to do with technology, you try and accommodate based on budget or these things. The more evolved and enlightened CIO or chief digital officer is going to understand operations, understand business problems, and bring ideas to the table, technology associated ideas. So not just waiting for what's requested, but bring suggestions. And to do that, you have to deeply know operations, right? Because you have to understand the business problem and in order to come up to suggest things. So uh, that's one of the things IT needs to be doing today is understand the business well enough to say, hey, there's tools out there, there's something out there that can really help with your business problem, and it may be cost effective and help you reduce costs overall, even though we would have to spend to get it. Dr. Rob, I'm going to start with you. How do you approach that? How do you find those areas where you want to infuse technology to help solve a business problem proactively, bringing it to the business because they didn't even know it existed?
The demand on us today is to understand data at every different ways. The data is the new liquid gold, as we say that. Second demand is experience is on us. Third demand on us is to make efficient operational work in disease management, congestive heart failure, diabetes, monitoring. Then there is a pressure on work and workforce automation to have digitally enabled new workers, automation of repetitive works. Then there is clinical trial, and I didn't even mention cybersecurity. We all went through crowd strikes, whatever happened to us, and nursing by itself to improve their documentation and the workflow. So we all know this. It's not that we don't. I'm lucky that we attend rounds, or our IT people go on rounds. My CMIO, he goes on rounds. Our IT clinical analysts, they go on rounds. And not only rounds, some also go to the home healthcare workers to understand what's happening.
Mm-hmm.
What happens during those rounds, something pops up. Uh, for example, we were thinking of doing a digital healthcare medicine department for congestive heart failure. Well, nobody has, very few people have thought about it. It's not that people have not thought about it. Or when we are sitting in a room and we're looking at 3 different types of EKG, but all the waveforms cannot be in one place. Or, so the common pain pops up. Those are our opportunities. When things pop up, then we have a side conversation, then we have a consensus conversation, and we bring those things up. For example, I'll tell you, Tufts University works with us in the academic area, but the thing is that we need to have nano certification. That means if you're a lab tech and you want to become a nurse, or you want to become a doctor, you can take 2 credit, 2 credit, 1 credit, 1 credit, till you have 100 credits, and boom, you get a nursing degree. So those kind of innovative ideas that come to mind, that's one. Second, sometimes there are projects that come out. Like, for example, hey, we want to use a colonoscopy clinic, but we want somebody to answer all the questions. Well, you already know your care model, you already know your treatment model. You put a Gen AI, put it in frequently asked question, put it in an app, and people can go to town asking as many questions as they want, but the answer is there. You see what I'm saying?
Mhm.
So what you're asking for is that, how does that happen? Trust. To actively seeking out relationship, actively. Third, know your business. Fourth, know what makes money. Because makes money means not only cash, but also brings experience and value. Because who would not like to go to a place where they feel that they're very important? Because it's kind of important to make our customers feel important. And the caregivers also feel important. And they also make happy. So like Tanya said, they're a destination center for childcare, for peds. People want to go to Stanford, right? If you're doing transplant, then you would love to come to Tufts, because you know that we do that, and we do that successfully. So when you're asking for that, hey, do you have a relationship with Uber? Do you have a relationship with Lyft? Can you provide some kind of other things? So those opportunities also come up, especially when you are seeing new things happening in the trillion-dollar industry, how they provide experience. So if you break it up, lastly will be, we do drug discovery. We do new treatment. How does that happen? So you work with the clinical researchers. Hey, these are the 11 tools we got that will help you to go faster for clinical trials. How do you recruit patients? So these are the conversation that happens, and we present that we can be your partner. Does that help to answer
That
your
helps.
question?
That helps 100%, and I think
Oh,
you're
thank
right
God.
on. And I'm going to
Thank God.
I'll follow up with Tanya on that. Um, you know, the key here, as Dr. Ub was saying, is you have to know about the problems. And you can't just know about the technology problems, because you need to know about the business problems. Many people, you may not be invited into a meeting because they think this has nothing to do with technology. But that doesn't make any sense, right? Because you need to know about all the problems, and you'll decide if there may be a technology solution to help here. How do you, so there's a couple things. One is to make sure you're in the right meetings and that people realize you need to be included in certain meetings. And the other thing is, you know, you personally can get out as much as possible, but you have a big job, but it doesn't always have to be you, right? Dr. Rob said it before. He had an IT person sort of situated in some sort of operational process just to be there. So it doesn't have to be you, it can be one of your team, but you need them out there so that those business problems can come back. Does that make sense? Tell me your thoughts.
Yeah, absolutely. So don't want to repeat too much, but yeah, we have a robust clinical informatics function, which is wonderful to have folks that have both clinical business experience and wear an IT hat, and they're out rounding all the time, kind of like Shafiq said. We also have people that have a service line liaison, so they're also right there, understanding the operation and the business. Also, I'll mention our governance model again. So another guiding principle that we have within this framework is operationally led and IT supported. So every one of our governance committees has a chair that comes from non-IT, so operations or an executive, and the co-chair or supporter is someone in IT. So that's another way to just ensure that the business is really driving what we need to do. And then I guess just back to the expense management conversation, and I'll say it again, but leveraging the tools we already have is a huge opportunity. So we just refreshed, as I'm moving into my second year here, we just refreshed our IT strategic plan, and it's incredibly robust with all sorts of ideas as to a lot of what we're talking about. So ranging from AI to clinician efficiencies to revenue cycle automation. We're doing ERP. And I'm really happy to say that almost none of it is going to cost us money because we're leveraging the tools and capabilities that we already invested in. There's a few exceptions to that, but for the most part, most of the plan is because we're understanding the business, working with our vendors and partners to meet that expectation, and continuing to advance capabilities. So there's just a few ideas there.
Tanya, real quick, a couple times you mentioned how important it is to know what you have in order to not buy what you don't need. Is that in and of itself difficult when you're very large, or is that sort of not an issue to get that inventory?
Yeah, it's difficult, particularly when you do have niche applications or niche products that meet a very specific need. But if you go with your big platforms, your ERP, your EHR, your ServiceNows, your service tools, your core platforms, Microsoft, if you stick with those, that should probably meet a very large footprint of capabilities. And then you bring in those niche products where you need to for any gaps. But yeah, keeping the inventory and understanding the capabilities is definitely a challenge in itself.
Sumit, I'm going to let you jump in wherever you want here. Lots of stuff that's been discussed. What are your thoughts?
The first thought, a lesson learned, that on Zoom you get a mirror image, and when you're adjusting your tie, it's very difficult to reconcile which side your tie is skewed. So that's a lesson
That's
learned
lesson one.
from.
Okay.
But I think everything that you have been talking about, and you had mentioned that if I could ask a question
Yeah,
of
sure. Feel free.
my
Go ahead.
panelists. In technology, in healthcare, Tanya and Dr. Rab, how much of the work that you're doing are driven by the board imperatives or your CEO's imperatives? And how much is it firefighting? That was a question I often have, considering that I've moved from a strategic background in financial services and others. That's something I'm always grappling with, that when I talk to the CEOs and others in some of the larger healthcare system, and allow me to say this, the only time I hear him talk about IT is when he's fending off the cybersecurity threat. How much of board presence does the IT leadership have within the healthcare provider system?
Shafiq, let's go with you first.
Why me? Why not Tanya?
Because Tanya just spoke, so it's your turn.
Okay, thanks a lot, man. So depends which organization you're working in, depends what market you are in, and depends what kind of financial situation you are in. That's the first depend. But no matter where you are, you have to deal with cybersecurity. And sometimes the firefighting is always there. It's not there, it's not there. But the thing that is helping us propel forwards, that app rationalization is part of firefighting. The decreasing of the passwords is firefighting. And what it does, it allows you to innovate in a way to standardize. The less, whether the less variation is there, the better it is. So IT by itself is a continuous improvement. So continuous improvement in the world of IT, which you're calling firefighting, is that how fast can you standardize? How fast can you have policies and procedure? How fast can you have governance? How fast can you have cultural alignment? That is the quest we all go for the firefighting. But the other one that you are asking for, board directive and the CEO directive, CEOs always have phenomenal plans for the business to go forward. Our job is to support that business go forward, whether we are doing, as we call it, community connect, giving some other people Epic, other hospitals Epic, or some other way of buying a new practice and putting our EHR there, our ERP there. That will continue. But on the back end, what I'm trying to tell you, Sumit, is that it's a continuous battle to improve ourselves. And we have not arrived there. Maybe 10 years from today, we will, when we have perfected the use of AI and we have perfected the cost of AI with our, like Tanya said, with our vendors that are primarily our ERP vendors, our EHR vendors, our ServiceNow vendors, they're all bringing those things to us. To buy your own AI is also expensive. So we are relying on some of them, but it's a continuous pursuit, Tony, that between the firefighting and between the innovation. But the thing that is good all about it, we all want to make our customers happy. We all want our physicians to be better, our nurses to be better, and the people who come to work here have the joy of working here. So that is the quest. That's our North Star. We have not stopped working on it. Does that answer your question, Sumit?
It does. If you'll allow me, Tanya, just to interject. Unfortunately, he's passed right now. Bernard Tyson, who was the CEO at Kaiser Permanente, and he used to always operate at 30,000 feet. But what I liked was his thesis, Tanya, was democratization of healthcare. That was his diktat. And he said cloud implementation would be a perfect enabler for democratization and reducing of cost within Kaiser. That's the correlation I'm bringing in, that a very high-end board imperative directly enabled through technology. Are we seeing that, please?
So I am already on the cloud. I'm sorry to interrupt, but what I'm saying is that we did that. It's not that we did not do that. And if you're not in the cloud, you may say you're not in the cloud. Most of this stuff is already in the cloud. So go ahead, Tanya. I'm sorry, I should not have answered him directly.
No, that's okay. I think going back to the original question, it was board presence, right? Board interaction. And I would agree with Shafiq. I think it depends. It depends on the organization, the culture, depends on the market, all of those things. So I might answer that differently from organization to organization. But in my current organization, in the strategic plan that's actually being refreshed for the enterprise, there's actually a small piece of the plan that calls on digital transformation. So the fact that it's in the strategic plan, it's talked about at the board level. I'm actually going to be meeting with them in just a couple weeks to do some education around what that means. It's just wonderful to have that opportunity to have, and I think location here in Silicon Valley certainly helps too in terms of our board members. So, but I've been in other organizations, to your question about where only time you get FaceTime with them is talking about cybersecurity and firefighting, which is important. It's a piece of our digital transformation, absolutely, a huge component of it. But the fact that we're calling it digital transformation and the board wants to be educated and understand what we're doing in that space is really exciting.
Got it. Thank you.
Excellent. Tanya, do you have a question for one or both of your co-panelists?
Oh, geez. So Shafiq and I do go way back. He taught me everything he knows from our experience on a previous board. And he tends to be very much a prophet. He seems to have the crystal ball for the future and pretty accurate and spot on when he does have those predictions. So Shafiq, what do you think the future holds in terms of where we're heading, where we're going? Do you think we'll be able to solve this challenge on the financial implications and situation that we're in with technology?
Yes. So the answer is yes. It'll take us about, in my mind, my friend, first of all, thank you for putting me at such a high place. But here's what it is. In my mind, we will realize we cannot depend upon the money we make today, either from all kinds of payers. We just can't. So what this will help us to do is to find different ways to still provide care, but make it faster, quicker, easier, but to also know how do we decrease the utilization of care. So utilization is the key And how do we reach out to our people, whether it's telemedicine, whether it is tele this and tele that. But more importantly, we will make our consumers powerful. Give you one example. We will allow our consumers to use ChatGPT to query their own electronic health record. We will allow our consumers to be able to become actuaries themselves. That if I do these three things, I will live longer. So it's not that far away. So to answer your question, what is really true is that each one of us will pay attention to our data. When the data is clean, how do we collect the data? What are the government regulations for claiming the data? Because only then we will be AGI ready, artificial general intelligence ready. So you will see that. So what I'm saying, why? Because all of us will get there. That's why 5 years. So to answer your question, we will fight this money business.
That's inspiring. Very good. Dr. Rob, do you have a question for one or both of your co-panelists?
Man, I just want to copy Tanya's governance structure because she has mentioned that so many times. So did you make the governance, or it was already there? Or like, how did you, how did you make yourself the core of the things? Like, how did you go through that process? I would like to learn that. Like, it's a very serious thing to have the governance in place. And that is the most difficult thing to get, like who's going to be there, who's not going to be there, who's not included, who's included. So how did you go through that?
Yeah, so a little bit of taking the existing structure that was there, that was already here when I got here, and just advancing it. So taking the structure, understanding how it worked, what was working, what we could do differently, and really talking about those roles and responsibilities. That was a big part of like the first education when we got together. So we actually call it the In It Together Committee. I think we've mentioned that earlier too. We're in it together. So it's now our In It Together committee, and it's myself and many of my peers from the executive team. And again, I mentioned I'm not the chair of that. So my boss is actually the chair of that committee. I'm just the co-chair. So it really helps set the tone. So having, your chief executive, chief operating officer as the chair of that committee just sets an expectation. And that was really the first kind of launch. It was a relaunch because, again, the committee sort of already existed. We just re-looked at membership, roles and responsibilities. We rolled out those guiding principles that I mentioned almost as a refresh, not necessarily creating something new or completely changing what was already here, but just advancing it and moving it into the future for digital transformation.
I love it, man. So eloquently said. Wow.
It was very nice. Very nicely said. All right, we have time for what I'll call a lightning round of final thoughts. Your best piece of advice. I always frame this up as for someone in a comparable position at another health system, your best piece of advice for, again, our overall theme of reducing costs and increasing value. Tanya, we'll go with you first.
Okay, I think we mentioned this a couple times, but understanding your data and data analytics, I think, is a key as we are looking to prioritize what projects and solutions we are going to be working on, making sure you have a good understanding of that ROI going into that project. So how are you going to measure value? Do you have the baseline? Do you have the metrics? And making that a key conversation on the front end, and then really hard to do, but showcasing that on the back end. Did we achieve those goals? If not, why not? Just almost as a lesson learned, so you can keep getting better and better with making sure you're making the right decisions in the future.
Very good. Dr. Rob, your final thought.
I think we are in a very unique place where we are in healthcare. So my first request to me and to my colleagues is that you're not alone in it. Seek counsel, find Tanya Thompson, find other people who they are doing what they are doing. Each one of us may sound like we are not doing a lot, but we are all doing a lot. And some may be common ground, something to learn from. Like I just learned something from Tanya. So I'm just telling you that we have to build a coalition of our own leaders to learn from each other. And what that really means is that we have to seek out. Most of us wait to go to a conference to meet. We're not seeking out. Only recently, I got a request from 7, 8, 9, 10 of us trying to talk about cybersecurity resilience. So I'm like, okay, that's not a bad idea because I have no idea what I'm doing. So that's number one. Number two request is the following. Don't lose hope. We are all in it together. This will become better because we have to have a healthy nation. And this will force us to think differently, work differently, and the salvation lies in information technology.
I love it. Very good. Sumit, your final thought.
The final thought is I genuinely think the healthcare industry, in line with what I started with, there is an existential crisis in terms of rising cost, uh, the overall aspect of reimbursement being lesser than the actual cost, overall quality of healthcare. And I think a crisis is an opportunity that one should take advantage of. And if we can really leverage and double down on technology, and there is enough available technology that could be used with a sense of urgency, I think it'll help and really ameliorate and improve healthcare industry per se, and reduce the differential aspects of healthcare that we find in different hospitals.
Excellent. Well, that is about all we had time for today. Tremendous conversation, really great stuff. Regarding continuing education, you could use the final slide in this deck. You'll get an email when the on-demand recording is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming panels. With that, I want to thank I do want to thank our panel, Tanya Townsend, Dr. Shafiq Rob, and Sumit Ganguly, and I want to thank GS Labs and GAV Technologies for sponsoring, and you for attending. And with that, everybody have a wonderful day. Thank you.
Very much.
Thank you.
Take care.